We all know that COVID-19 had invaded the worldwide and largely changes our lifestyle since the last 2 years. But do you know that post-COVID life is a main concern for now? And a lot of COVID-19 survivors had the COVID-19 symptoms persist for a few weeks or few months, even they had recovered from COVID-19. Yes, this is what we call as long COVID. And I have did a cross-sectional study and recruited 127 participants through the online survey to determine the impact of COVID-19 on the quality of life amongst the COVID-19 survivors in Malaysia using the St. George's Respiratory Questionnaire. My study found that most of the COVID-19 survivors had a reduction of the quality of life, and this became even worse when they had the long COVID symptoms, as well as a greater duration of long COVID symptoms. Besides, a few previous studies stated that COVID-19 survivors with long COVID will have a decline in the physical and mental function, as well as social participation. Then we found that there are few significant predictors for low quality of life amongst the COVID-19 survivors, particularly the COVID infection stages, existing health condition, and also female gender. Some studies stated that increase in the severity of COVID-19 infection will lead to the reduction in pulmonary function, and also a study stated that female had a weaker immune system compared to male, and another study stated COVID-19 virus will aggravate and worsen the pre-existing health condition, and all of this explain why COVID-19 survivors with factor associated had a poorer quality of life compared to others. Therefore, the clinical implication of our study suggests that whenever any COVID-19 survivors experience persistent COVID-19 symptoms or had been diagnosed with COVID-19 less than 12 weeks, physiotherapy intervention should be planned specifically inspiratory muscle strengthening and endurance training in a pulmonary rehabilitation program. Besides, this study also helped to increase the awareness of the public that the long COVID impact of the COVID-19 on their post-COVID life. In conclusion, COVID-19 survivors had a reduction in the quality of life, particularly for those with long COVID. And this study provided the insight for the healthcare professional about the needs for early pulmonary rehabilitation for COVID-19 survivors and created public awareness about the negative impact of long COVID on their quality of life. Thank you.